As a retired doctor with decades of experience, I've seen it all. I've helped men through their health struggles, guided them through complex conditions, and provided counsel that, I hope, made a difference. But there's one question that has always lingered in the background, a question that many of my patients would often ask, yet few felt comfortable talking about. Does masturbating every day affect your prostate health? Now, I understand why this topic might cause discomfort, even embarrassment. For years, it's been shrouded in a veil of stigma and misinformation. But as a doctor who has seen the long-term consequences of ignoring the body's natural functions, I can't stand by any longer without addressing this head-on. Let's get something straight right away. This is not your typical, here's what you should know health talk. This is about taking a closer look at something that many men secretly struggle with, something that has been misunderstood for far too long, and peeling back the layers of confusion. For years, the idea that masturbation could harm your prostate health has been widely debated, even feared. But what if the truth is different? What if daily masturbation could actually be good for you? Yes, you heard that right. For many, the thought of masturbating regularly might bring up images of shame or guilt. Perhaps you've heard that it's unnatural, that it leads to infertility, or that it somehow weakens the body. These misconceptions have been ingrained in us for years, passed down by old wives' tales and sometimes even cultural taboos. As a result, many men live with the fear that their private habits are quietly damaging their health, especially when it comes to something as crucial as their prostate. But I'm here to tell you, as someone who has spent a lifetime in the medical field, that the truth is more complicated than what you've been told. There is no simple black and white answer. What I can share with you, based on decades of experience and backed by scientific research, is that masturbation may actually have benefits, especially for your prostate. But how can this be true when you've been told for so long that it's harmful? This isn't just about clearing up misconceptions. It's about understanding the science that connects your daily habits with your long-term health. As a retired doctor who's seen the impact of health decisions over a lifetime, I know how important it is to get the facts straight. Ignoring your body's needs or letting myths dictate your behavior can lead to serious consequences later in life. That's why I'm inviting you to join me as we explore this fascinating and sometimes misunderstood topic. You see, your prostate is a small gland with a big job. It plays a crucial role in your health, and keeping it in good shape can make a significant difference in your overall well-being. So let's take a closer look at what's really happening when you engage in daily masturbation and how it affects your prostate health. Before we dive into the science, I want you to pause and ask yourself, how much do you really know about your own body? The prostate is not something most men think about until there's a problem, but the truth is, this small gland needs your attention throughout your life. You can't afford to ignore it, and if you've been feeling uncertain or fearful about your habits, it's time to confront those fears head-on and replace them with knowledge. I've seen firsthand how misinformation can cause unnecessary worrying. I've watched men struggle with anxiety about their health, wondering if their daily habits are doing more harm than good. But after decades of medical experience, I've learned that the truth is often more complex and more empowering than we realize. So if you've ever wondered if masturbating daily could actually be helping your prostate, or if you've been haunted by fears that it's doing irreparable damage, stick with me. We're going to take a deep dive into the research, and I'll give you the facts you need to make informed decisions about your health moving forward. Before we get started, though, I need to ask for your support. If this topic interests you and you want to hear more about the truth behind prostate health, please take a moment to subscribe to my channel. Your support motivates me to continue bringing you valuable, fact-based information that can help you live a healthier, more confident life. Don't forget to hit that notification bell so you never miss a new video. Now, let me ask you a question that will help guide our discussion. Do you believe that frequent masturbation can benefit your prostate health? A yes, it could be beneficial. B no, it can only cause harm. Drop your answer in the comments below. I can't wait to see your thoughts, and I'll be sure to respond to your answers personally. Let's start this conversation and build a community that is informed, not afraid, to talk about these important topics. As a retired doctor who spent many years observing the complexities of men's health, I've come to realize that the prostate is often misunderstood and neglected. It's a small, walnut-sized gland, yet it plays a significant role in your overall well-being. I want to take this opportunity to share the importance of this humble gland and what it does for men's health, especially as they age. When I first started my medical career, I noticed a recurring theme among many of my male patients. They didn't truly understand what their prostate was, what it did, or how crucial it was to their health. It's easy to overlook something so small, but the truth is that the prostate can be the key to many of the issues men face as they get older. And if it's not properly cared for, it can lead to some serious complications. Let's start with the basics. The prostate is located just below the bladder and surrounds the urethra. It's not something that many men think about often until problems arise, but it's involved in an essential function. The primary role of the prostate is to produce seminal fluid, which nourishes and transports sperm during ejaculation. In essence, the prostate is vital for fertility, playing an active role in enabling sperm to reach their destination. But the prostate's importance goes beyond reproduction. Its health affects many aspects of your life, from urinary function to hormonal balance. The prostate contributes to the regulation of urine flow, which is something most men take for granted until it starts to malfunction. As the prostate enlarges or becomes inflamed, it can press against the urethra and cause issues like frequent urination, weak urine flow, or difficulty starting and stopping urination. These issues are more common as men age, and they're often the first sign that something might be wrong with the prostate. And then there's the matter of the hormone regulation the prostate plays a role in. The prostate produces enzymes that help regulate the balance of hormones in the body, including testosterone. When something goes wrong with the prostate, it can lead to hormonal imbalances, which may, in turn, affect a man's overall health, mood, and even libido. I've had many conversations with patients who felt frustrated or worried about changes in their energy levels, sexual function, or mood, and many times, those symptoms were linked to problems with the prostate. As men age, the prostate is prone to various health conditions. Benign prostatic hyperplasia (BPH) is one of the most common conditions that affect the prostate in older men. This condition causes the prostate to enlarge, and as it presses against the urethra, it can result in urinary problems like urgency, frequency, or even difficulty completely emptying the bladder. While BPH is non-cancerous, it can still affect a man's quality of life and requires management. Then, there's the issue of prostatitis, which is an inflammation of the prostate, often caused by infection. This can lead to pain, swelling, and difficulties with urination and sexual function. And, of course, there's the more serious risk of prostate cancer. Prostate cancer is one of the most common types of cancer in men, especially as they age. It starts in the prostate and can spread to other areas of the body if left untreated. But here's the thing: prostate cancer can often be slow-growing and asymptomatic in its early stages, which is why regular checkups and screenings are so important. If caught early, prostate cancer is highly treatable. This is why it's crucial to pay attention to the health of your prostate and to recognize the signs early on. While it's small in size, the prostate is disproportionately important to a man's health, and neglecting it can lead to serious consequences. Many men simply don't think about their prostate until problems arise, but proactive care can make all the difference in maintaining good health. In my years of practice, I've seen firsthand how men's attitudes toward their health can change once they understand the role of the prostate. It's not just a reproductive organ, it's integral to the quality of life, urinary function, and overall hormonal balance. When I talk to my patients now, I encourage them to take their prostate health seriously, even if they don't notice any immediate issues. Just because you feel fine doesn't mean your prostate is in the clear. The prostate, like many other parts of the body, needs care and attention. But here's the good news: you can take steps to help maintain a healthy prostate and reduce your risk of developing problems. A balanced diet, regular exercise, stress management, and early screenings are just a few of the ways you can support your prostate health. And while it may seem small, paying attention to your prostate can prevent much larger health problems down the road. As I reflect on my years in practice, I find that the men who took an active role in their health were the ones who thrived the most. The ones who got regular checkups, asked questions, and took preventative measures. It's not about waiting for problems to arise before taking action. It's about being proactive and understanding that your prostate's health is key to your overall well-being. If there's one thing I hope you take away from this, it's that your prostate matters. It may be small, but it's mighty. It plays a crucial role in your health, and taking care of it can have a profound impact on your life. Don't ignore it. Get informed, get checked. Your future self will thank you for it. This is a reminder that the prostate, though often overlooked, should never be taken for granted. It's time we stop shying away from these essential conversations about men's health. As a retired doctor with decades of experience, I've seen countless patients come and go, each one with unique concerns and questions about their health. Yet, one question that always seemed to quietly linger in the background was about the connection between masturbation and prostate health. It's a question that's often swept under the rug, brushed aside in hushed tones, yet it's one that's deeply significant for men. Over the years, I've come to understand that the real answers to this question are not as simple as most people might think. The relationship between masturbation and prostate health is far more complex and nuanced than many believe. So, let me share with you what I've learned, based on years of research, clinical experience, and the scientific studies that have emerged on this topic. I want to start by acknowledging the confusion that exists around masturbation and its effects. For decades, there has been a prevailing fear, especially in certain cultural and social circles, that masturbation is something to be ashamed of, something that could potentially harm the body. The idea that it could affect vital organs, like the prostate, has contributed to this stigma. But as a doctor, I've always been committed to looking at health from an evidence-based perspective, and what the research shows is that the truth is far less straightforward than the myths suggest. Let me take you back to a groundbreaking study that shaped the current understanding of how frequent ejaculation might benefit prostate health. In 2016, a team of researchers from Harvard University published a large-scale study in the prestigious journal European Urology. The study tracked the health of over 31,000 men for nearly 2 decades. These men, ranging in age, lifestyle, and health status, were asked to report how frequently they ejaculated. The researchers then analyzed their prostate cancer risks based on the frequency of ejaculation. The results were striking. Men who ejaculated at least 21 times per month had a 31% lower risk of developing prostate cancer compared to those who ejaculated fewer times, between 4 to 7 times a month. This is significant, especially when you consider that prostate cancer is one of the most common cancers affecting men worldwide. The findings from this study were so compelling that they sparked a new wave of discussion about the potential benefits of regular ejaculation, including through masturbation. Now, you might be wondering how something as simple as ejaculation could possibly have such a profound impact on prostate health. Well, the theory behind this is rooted in the idea that ejaculation might act like a natural cleanse for the prostate. Every time you ejaculate, the prostate is essentially releasing and flushing out substances that could otherwise build up over time. Some of these substances include inflammatory compounds, which can contribute to chronic inflammation. Chronic inflammation in the prostate is known to be a key risk factor for prostate conditions like benign prostatic hyperplasia (BPH) and, of course, prostate cancer. But it doesn't stop there. Masturbation, and sexual activity in general, isn't just about the physical act of ejaculation, it's also about the hormonal response that follows. When you reach orgasm, whether through masturbation or intercourse, your body releases a cocktail of hormones, including endorphins and oxytocin. These are often referred to as feel-good hormones because they have a calming effect on the body. They help reduce stress, and stress, as many of us know, can be incredibly damaging to the body, including the prostate. Chronic stress is known to exacerbate inflammation, disturb hormonal balance, and increase overall health risks, so any activity that reduces stress can be seen as beneficial. To further support this, another study published in the Journal of Sexual Medicine in 2017 reinforced the connection between frequent ejaculation and prostate health. This study focused specifically on younger men in their 20s and 30s and found that men who ejaculated regularly during these decades were less likely to develop prostate cancer later in life. These findings don't guarantee that regular ejaculation will prevent prostate cancer, but they do suggest a potential protective effect, which is something that's been largely ignored in past health discussions about masturbation. I know what you might be thinking now. This sounds too good to be true. How could something like masturbation actually be good for me? It's understandable to feel skeptical, especially when you've been conditioned to think of masturbation as something that could harm you. But as a doctor, I can assure you that these studies, combined with my own clinical observations, suggest that masturbation, when done in moderation, could be more beneficial than harmful to your prostate health. But before we get too carried away, I want to clarify a very important point. Just because ejaculation has these potential benefits doesn't mean that frequent masturbation is a cure-all for prostate health. There's no magic bullet when it comes to maintaining prostate health, and masturbation is not an exception to this. If a man is already experiencing prostate issues like BPH or prostatitis, simply masturbating more frequently is not going to solve those problems. Prostate health requires a holistic approach that involves a healthy diet, regular exercise, stress management, and, of course, regular screenings with your doctor. Masturbation is just one part of the picture. What these studies show is that it may be one of many factors that can help keep the prostate healthy over time. It's like maintaining your car, regular oil changes, checking the tire pressure, and making sure everything runs smoothly helps ensure that the engine stays in good shape. But if there's something seriously wrong with the engine, an oil change isn't going to fix it. Similarly, regular ejaculation might support prostate health, but it's only effective when combined with other healthy lifestyle choices. As a doctor, I've seen far too many men ignore their health until something goes wrong. They wait until they feel symptoms or face serious complications before taking action. But the truth is, it's the small, everyday habits that matter. If you care for your prostate consistently through a balanced lifestyle, regular exercise, a healthy diet, and yes, even occasional masturbation, you'll be doing yourself a great favor in the long run. As I reflect on my years of experience, I've come to realize that the most important thing for men is not to be afraid to talk about these issues. For too long, men have been told to keep quiet about their sexual health and their prostate, but it's time to change that. The more we talk about it, the more we understand how crucial it is to maintain a healthy prostate. Masturbation may be one part of that equation, but it's just one piece of a much larger puzzle. So, if you've ever been unsure about the connection between masturbation and prostate health, I hope this sheds some light on the subject. The science is clear, and it's time to embrace the facts. Taking care of your prostate isn't just about avoiding the bad habits, it's about adopting the good habits and making sure you're doing everything you can to protect your health for years to come. As a retired doctor with decades of experience, I've spent my career not only treating patients, but also listening to their fears, concerns, and misconceptions about their health. One of the most persistent and damaging misconceptions I've encountered, particularly when it comes to male health, involves masturbation and its effects on the prostate. Over the years, I've heard it all. Masturbation causes infertility, it weakens the body, and it can cause prostate cancer. These myths have plagued many of my patients, leading them to make decisions based on fear rather than facts. Today, I want to address these myths head-on, providing clarity on what's true, what's not, and why these misunderstandings persist. Let's begin with a myth that I have heard time and time again, one that is perhaps the most pervasive: masturbation causes infertility. I've had countless conversations with men who believed this myth so deeply that they avoided masturbation altogether, fearing it would impact their ability to father children. As a doctor, it's my job to dispel such harmful misunderstandings. Here's the truth: masturbation does not affect sperm production or quality. Your body continuously produces sperm, and ejaculation, whether it occurs through sexual intercourse or masturbation, simply releases what your body has already produced. In fact, masturbation has no impact on fertility unless other underlying conditions, such as low sperm count, hormone imbalances, or other health issues, are present. So, If you've been avoiding masturbation because you're worried about infertility, it's important to recognize that this concern is unfounded. Masturbation is a natural process that doesn't interfere with your ability to have children. Another myth I want to address is the claim that masturbation weakens your body or drains your energy. This idea, often perpetuated by outdated cultural taboos, suggests that regular masturbation can deplete your physical strength, leaving you exhausted and lethargic. I've seen many patients who, in their younger years, believed that masturbation was something to avoid in order to preserve their vitality. The truth, however, is quite different. Masturbation, in fact, can be quite the opposite of weakening. When done in moderation, it can actually help reduce stress, promote relaxation, and even boost mood. This is because, during orgasm, your body releases a cocktail of beneficial hormones, including endorphins and oxytocin, both of which help to elevate your mood and alleviate stress. In other words, rather than draining you, masturbation can leave you feeling more relaxed and even more energized. It's a natural way to release tension and help the body unwind. So, if you've been holding onto the belief that masturbation somehow weakens your vitality, it's time to let go of that myth. Then, there's the myth that masturbation can cause prostate cancer. This one has been particularly troubling, as it feeds into men's fears about their sexual health and leads many to believe that their natural bodily functions are somehow dangerous. I've encountered numerous patients who feared that their sexual habits could lead to cancer, which caused them unnecessary stress and anxiety. However, this myth is not backed by science. In fact, recent research suggests that frequent ejaculation may actually lower the risk of prostate cancer. As I mentioned in earlier discussions, a large study conducted by Harvard University in 2016 found that men who ejaculated at least 21 times per month had a 31% lower risk of developing prostate cancer compared to men who ejaculated less frequently. The theory behind this is that ejaculation may help to flush out harmful substances, such as inflammatory compounds, from the prostate, reducing the risk of developing prostate-related diseases. So, rather than causing prostate cancer, frequent ejaculation may be a protective factor. It's crucial to recognize that these myths often have their roots in outdated beliefs or cultural norms rather than scientific evidence. They've been passed down over generations, and for some reason, these misconceptions have become deeply ingrained in many men's minds. As a doctor, I've always believed that the key to combating these myths is education, empowering people with the knowledge they need to make informed decisions about their health. That said, it's also important to note that while frequent ejaculation can have potential benefits for prostate health, it's not a catch-all solution. Masturbation, or ejaculation, will not prevent all prostate problems. Conditions like benign prostatic hyperplasia BPH, an enlargement of the prostate, or prostatitis, an inflammation of the prostate, are not directly influenced by how often a man ejaculates. These conditions require a combination of other preventive measures, such as diet, exercise, and regular medical checkups. So, while masturbation might help reduce the risk of prostate cancer, it won't necessarily prevent other prostate issues. It's important to keep in mind that prostate health is multifaceted and should be approached from various angles. Now, let's address another common misconception that often goes hand in hand with the others. Masturbation is an unnatural or shameful act. I've had many patients, especially older men, who were made to feel guilty or embarrassed about their sexual health and habits, largely due to societal taboos. They were taught to repress their sexual urges, believing that any form of self-pleasure was a sign of weakness or immorality. This, in turn, often led to unnecessary shame, guilt, and confusion about their own bodies. As a doctor, I've always felt that it was my duty to alleviate these feelings and help my patients understand that masturbation is a natural and normal part of human sexuality. There is no shame in masturbation. It's a healthy way to explore your body, release sexual tension, and even improve mental well-being. We've all been taught that talking about sexual health should be taboo, but it's time to break those barriers and start discussing it openly. A healthy relationship with your body involves accepting and understanding your own sexual needs and desires without guilt or shame. Masturbation, in this sense, is simply a natural expression of your sexuality. Finally, I want to stress that the overall message here is about balance. Masturbation is not a cure-all for prostate health, and it should never replace healthy habits such as regular physical activity, a balanced diet, and regular checkups with your doctor. The key is moderation and understanding how it fits into your overall lifestyle. If you find that masturbation is becoming compulsive or interfering with your relationships or daily responsibilities, it might be time to step back and reevaluate your habits. Like anything in life, moderation is key. In the end, the myths about masturbation and prostate health are just that, myths. It's time to separate fact from fiction, to embrace the scientific evidence that shows masturbation in a new light, and to start taking care of your health with the knowledge and understanding that you deserve. So, if you've been living with guilt or fear about masturbation, I encourage you to let go of those concerns and start focusing on what truly matters, taking care of your prostate and overall health in a balanced, informed, and healthy way. As a retired doctor who has spent decades treating patients and studying the intricacies of male health, I can tell you that prostate health is something most men don't think about until it's too late. It's easy to overlook this small, walnut-sized gland, but taking proactive steps to maintain its health is critical. Too often, I've seen men wait until they experience symptoms or face serious health issues before they address their prostate. But the truth is, maintaining a healthy prostate requires a lifelong commitment to healthy habits. In my years of practice, I've seen that the men who took charge of their health, who didn't wait for problems to develop, were the ones who had the best outcomes. So let me share with you some practical advice that I've seen work time and again, advice that can make a significant difference in maintaining your prostate health, not just today but for years to come. One of the most powerful tools in maintaining prostate health is diet. As a doctor, I've always stressed the importance of food as medicine. What you put into your body can have a profound effect on how well your prostate functions. A prostate-friendly diet should focus on foods that are rich in nutrients and antioxidants, while limiting foods that promote inflammation and contribute to other health issues. First and foremost, you need to focus on a diet rich in fruits, vegetables, and healthy fats. I often recommend my patients include a variety of colorful fruits and vegetables in their meals, things like tomatoes, which are packed with lycopene, a powerful antioxidant that has been shown to support prostate health. Leafy greens, berries, and cruciferous vegetables like broccoli and cauliflower are also great choices, as they provide vitamins, minerals, and phytochemicals that can help protect the prostate from damage. Fatty fish like salmon, which are high in omega-3 fatty acids, also play a crucial role in reducing inflammation and promoting overall prostate health. On the flip side, it's important to limit red meat and processed foods. While red meat can be a good source of protein, it's also high in saturated fats, which can increase inflammation in the body. Processed foods, particularly those high in sodium and preservatives, can contribute to chronic health problems, including prostate issues. I always encourage my patients to reduce their intake of these foods and focus on whole, minimally processed options. A healthy diet doesn't have to be complicated, but it requires intentional choices that prioritize your well-being. Next, I cannot emphasize enough the importance of staying active. In my experience, exercise is one of the best things you can do for your prostate and for your overall health. Regular physical activity is crucial for improving circulation, reducing inflammation, and maintaining a healthy weight. Prostate health is closely linked to how well your body functions as a whole, and regular exercise helps ensure that everything is running smoothly. Whether it's walking, cycling, swimming, or strength training, find an activity that you enjoy and stick with it. I always tell my patients that consistency is key. Aim for at least 30 minutes of moderate exercise most days of the week. And if you're someone who's sitting for long periods throughout the day, take regular breaks to move around. Whether it's a short walk or stretching, every little bit of movement counts. In addition to regular physical activity, pelvic floor exercises or Kegel exercises are another great way to support your prostate health. While Kegel exercises are often associated with women's health, they can also be incredibly beneficial for men. These exercises help strengthen the muscles of the pelvic floor, which support the prostate and improve urinary control. Many men experience urinary difficulties as they age, and strengthening these muscles can help alleviate some of those issues. It's a simple and effective way to promote prostate health without a lot of time or effort. However, maintaining a healthy prostate isn't just about what you eat or how much you move. Managing stress is equally important. I can't count the number of patients I've seen who were dealing with chronic stress, only to find that it exacerbated their health issues, including problems with their prostate. Stress has a direct impact on the body's hormonal balance and can contribute to inflammation, a major risk factor for many prostate conditions. So, it's vital that you incorporate stress management techniques into your daily routine. Whether it's through mindfulness practices, yoga, or simply engaging in hobbies that bring you joy, finding ways to relax and unwind can make a world of difference. I've seen firsthand how managing stress can improve overall health, reduce the severity of prostate issues, and even help to prevent future complications. Stress management doesn't have to be complicated. It could be as simple as taking a few minutes each day to breathe deeply, practicing gratitude, or taking time for a walk in nature. The key is consistency and finding what works for you. In addition to diet, exercise, and stress management, regular health checkups are absolutely essential for maintaining prostate health. I can't stress this enough. Early detection is critical. Prostate cancer, in particular, is a disease that often develops slowly and without noticeable symptoms in its early stages. That's why it's so important to get regular checkups, especially as you age. I recommend that men start getting screened for prostate health at age 50, and earlier if they are at higher risk, for example, if they have a family history of prostate cancer or if they are of African descent. The two most common tests are the prostate-specific antigen PSA test and the digital rectal exam DRE. While these tests may not always provide a definitive diagnosis, they can help catch any potential issues early, when treatment is most effective. Lastly, one of the most important factors in maintaining prostate health is communication with your healthcare provider. Don't be afraid to ask questions or discuss concerns about your sexual health or prostate. A good doctor will listen to your concerns, provide guidance, and help you navigate any issues that may arise. Prostate health is a sensitive subject for many men, but it's crucial to break through the embarrassment or hesitation and have open, honest conversations with your doctor. You are your best advocate, and taking an active role in your health is one of the most powerful things you can do. Prostate health is not something that should be left to chance. It requires proactive care and attention, but the good news is that by following these simple but effective tips, eating a healthy diet, staying active, managing stress, getting regular checkups, and communicating with your doctor, you can significantly reduce your risk of prostate issues and live a long, healthy life. I've spent a lifetime in medicine, and I've seen the difference that these habits can make. The key is consistency and making small but meaningful choices that support your prostate health over time. Your prostate may be small, but it's mighty. And by taking care of it now, you'll ensure that it continues to support you for years to come. As we've explored in this video, the connection between masturbation and prostate health is far more complex than many of the myths circulating around it. There's a lot of misinformation out there, but through science and years of medical experience, we've been able to uncover a clearer picture. The truth is that daily masturbation, in moderation, can have several positive effects on your prostate health, including potentially lowering the risk of prostate cancer and helping reduce stress. However, it's important to remember that masturbation is not a cure-all. Prostate health is influenced by many factors, such as diet, exercise, stress management, and regular medical checkups. Masturbation can play a role in maintaining a healthy prostate, but it needs to be part of a broader, more balanced approach to well-being. The studies we've discussed emphasize the importance of moderation and how frequent ejaculation might help to clear out the prostate and lower harmful substances like inflammatory compounds. But it should not be the only strategy for preventing prostate health issues. The key takeaway here is that taking care of your prostate and your overall health requires a holistic approach. It's not just about the occasional habit you form or the things you avoid, but about the consistent choices you make every day. The foods you eat, the physical activity you engage in, the stress you manage, and yes, even the way you treat your sexual health all play important roles in keeping your prostate functioning optimally. One of the most powerful lessons here is the importance of awareness. Too many men don't think about their prostate health until something goes wrong. They either don't know enough or they simply put it off. But the truth is that early intervention can save lives. Prostate cancer, when caught early, is highly treatable, and many prostate issues can be managed with lifestyle changes. Regular health checkups, a balanced diet, physical activity, and mental well-being can all play a part in preventing problems before they arise. So, the next time you think about your health, particularly your prostate health, remember that knowledge is power. Understanding what contributes to a healthy prostate and making conscious choices every day will help you lead a longer, healthier life. Don't wait until problems arise to take action. Be proactive and start living a healthy lifestyle today. To sum up, the most important lesson here is that prostate health doesn't have to be shrouded in fear or embarrassment. It's a normal part of being human, and taking care of it is something every man can do with the right knowledge and approach. I encourage you to take this information and apply it to your life, whether it's through maintaining a healthy diet, staying active, managing stress, or simply staying informed and regularly checking in with your doctor. Your prostate health is something that deserves attention. Now, I'd like to ask you, what habits or lifestyle changes have you made to support your prostate health? I've made changes to my diet and exercise routine. I haven't yet, but I plan to start paying more attention. Please share your thoughts in the comments below. I would love to hear your experiences and opinions. Your feedback not only helps others, but encourages a deeper discussion about maintaining good health. If you found this video helpful, please subscribe to the channel, give it a thumbs up, and feel free to donate to support the content. Every little bit helps and motivates me to continue providing valuable content for you. I may be getting older, but my desire to share useful knowledge with you remains strong. Your support, no matter how small, makes a huge difference in continuing this journey of educating and empowering people. Thank you for your time, and I look forward to bringing you more content that will help you live your healthiest life.